Hi, my name is Dr. Larkin Hoyt. I am the clinical director for CHE, Caring Health for Everyone's outpatient services. And today I'm here to talk a little bit more about trauma and what is trauma. So in a previous video, we talked generally about what is trauma-informed care, and I'd like to take a little deeper dive into, what trauma-related issues tend to be the most common. And we'll start with that. So what trauma-related issues tend to be the most common? I have to say that really depends. The best way to answer that question is to understand the types of trauma a person could possibly experience within their lifetime. The two types of trauma that can occur are one, naturally, which we also call sometimes in our communities, we call those acts of God. So examples of these types of trauma include, epidemics, wildfires, famine, tornadoes, hurricanes. The second type of trauma is actually caused by people, either accidental or intentional. So accidental examples include events like oil spills, car accidents, structural collapses, etc. Whereas examples of intentional acts include events like terrorism, school violence, which is often coming to be more common in our communities than we would like, interpartner violence, suicides, homicides, physical abuse. The list can be pretty extensive when it comes to intentional acts. So what's the impact or difference between the two? You might ask yourself. So human-caused traumas are fundamentally different from natural disasters. They, like I said, are either intentional, such as interpartner violence, also known as domestic violence, or unintentional, such as structural collapses, like what we've seen in Florida. So how a person or community will respond to these traumas often depend on their intentionality. So survivors of an unintentionally human-caused traumatic event may feel very angry and frustrated because of the lack of protection or care offered by the responsible party. Whereas in intentional human-caused acts, survivors often struggle to understand the motives of the perpetrator, the calculated or random nature of the act, and the psychological makeup of the person or the actual group that intentionally engaged in this behavior. So then we might build upon these kind of thought process and ask ourselves that bigger question: how do we know if the trauma we witnessed or experienced will develop into a trauma or a stress-related disorder? Well, again, there's the gray. It's not just black and white. That depends. It's important that we recognize the context of the trauma, like where it occurred, how did the community respond, how was the person supported. So context to a particular event can have significant impact for whether and how people experience shame as a result of the trauma. The kinds of support and compassion that people receive that were exposed to the trauma, whether their experiences are normalized or they're diminished or devalued by others, and even the kinds of service they are offered, can really help them recover and cope and prevent a trauma and or stress-related disorder. So keep in mind, trauma often accompanies stressful situations, like being bombarded with many things at one time. So without sufficient time or ability to address them emotionally, cognitively, and spiritually, and or physically, which I actually said in our last video, but I'll say it again, is extremely important. So rapid exposure to numerous traumas, one after another, lessens one's ability to process the event before the next attack. So this can create a cumulative effect, like a big tidal wave, if you will, making it more difficult to heal from any one trauma. So survivors need time and a safe place that is not stress-induced environments to begin and heal that process. Trauma itself can create significant distress, but often the losses associated with the trauma have a far more reaching effect than the trauma itself. In other words, when we evaluate the impact of trauma, it's helpful to access and discuss the losses that may happen, that can be acquired or are associated with the initial trauma itself, and what can compound after the trauma. And so the number of losses can greatly influence a person's ability to bounce back, or what we call in psychology, create resiliency from that tragedy. So when we're assessing the impact of trauma, not just the context, but the impact, we do have to look at the risks as it relates to possible losses that may be downstream for a person or a group. So that might be, if the trauma has such an impact and they haven't had time to heal in a safe place, what could potential losses be for them? Is there going to be isolation? Is there going to be a sense of loss from the family unit? Is there going to possibly be risk from loss of vocational or job associated pieces? Is there a loss from social interactions, daily habits, hobbies? All of those number of losses can greatly influence an individual's resiliency. And it is important for us to take a pause and determine treatment plans that can help contain and keep those pieces of a person's life intact. Another important clinical issue in understanding the impact of trauma is the meaning that the survivor has attached to the traumatic experience. So when we look at a trauma, it's so important to ask the survivor to reflect and think about, maybe not just all of a sudden, but to find meaning in that loss. Now, that could be a very difficult task that we're strapping the survivor with, so we must deal with this with compassion and care and consideration and patience and time, because a survivor isn't necessarily going to find meaning at the beginning of a trauma. And they also are going to experience the change in meaning, because as we go through this life, we have to recognize that meaning definitely takes on different, and it changes. It takes on, different stances in our life. It formulates. It begins to develop a mosaic for us. What was meaningful 1 year prior, maybe in the beginning of a traumatic event, that meaning may take a very different shape for a person 5 years post-traumatic event. And so a survivor's beliefs and assumptions of the event contribute to how they process, react to, cope with, and recover from that event. So one last thing in this series, and we'll talk more about it in the next series, is how does an individual trauma impact a person? So individual trauma can occur in a person's lifetime. We mentioned that, or I mentioned that. An individual trauma refers to an event that only occurs to one person. It can be a single event, like a physical attack, a work-related physical injury, a sexual assault. It can also be multiple or prolonged events, like a life-threatening illness or multiple physical assaults. So survivors of individual trauma may not receive the support and concern that members of collectively traumatized groups and communities receive. And that's important to take note of, because they are less likely to reveal their traumas or to receive validation of their experience. One piece that is a common side effect of trauma is shame, and it's a dangerous place to live in, because shame is a common feeling or thought that coincides with trauma, and it can distort the survivor's perception of responsibility for that event. Some survivors of individual traumas, especially those who have kept that trauma a secret when stigma is surrounded like it around sexual assault or incest, may not receive needed comfort and acceptance from others. And they are also more likely to struggle with issues of causation. For example, a young woman may feel unduly responsible for a sexual assault that took place on a college campus. They may feel more likely to feel isolated by the trauma, to experience repeated trauma that makes them feel victimized. So therapy can be critical for the survivor's mental and physical health, and knowing they have a safe space to share, process, and discuss the impact of the event on their lives is critical. So I encourage, whether you are a mental health professional or you are a family or good friend and happen to listen to this, if you know of someone that has been through a trauma, whether collectively, individual, single, or multiple or prolonged events, therapy can be very impactful, and it doesn't have to have been, the trauma doesn't have to have been, in the last 90 days or the last year. It could have taken place 10 years ago. And again, we encourage people to step forth to fight that stigma bust, and know that they're not alone, and know that support is out there for people that go through traumatic events. And licensed mental health professionals that are trauma informed can help. I'd like to thank you for taking the time to listen to the second episode of this trauma series. And we at CHE are always here to help. We're at www.cheservices.com, and you can always call us as well. And that phone number, and let me grab it, is 1-888-515-3834, and that's CHE Behavioral Health Services, caring health for everyone. And my name is Dr. Hoyt, and thank you, and I hope you have a wonderful day.